Okay, so I had a lot of questions about the uterine manipulator instrument that I mentioned in one of my posts from last week. So I wanted to essentially demonstrate what this instrument looks like and how we use it during surgery. So this is one type of uterine manipulator. Okay, this is the part that actually gets inserted through the cervix onto the inside of the uterus. And once it gets inserted into that area, one of the ways that we help it stay is we can actually blow it up with a little bit of air, so that it sits inside the uterus and hopefully doesn't move around. Okay, so we'll just collapse that back. You can see that there are some number markings on here. Okay, these are centimeters, and this is how we know how deeply or how far we should insert this portion of the manipulator into the inside of the uterus, because not every person's uterus is the same size, so we can individualize it. Once we place this part inside the uterus, then there's this sliding part. Well, it slides for now. There's this sliding part that we move up to surround the cervix, okay, with this cup that you see here. So the cervix actually sits down inside this cup, and we actually use this cup edge to plan where we will make our incision to detach the uterus and cervix from the top of the vagina. That's called a colpotomy during a hysterectomy. And so this moves because, again, not everybody's uterus is the same size. And then we can actually snap it in place with this little plastic part right here so that it stays. It's not going to slide anymore if I do that. Okay. Another important part is the handle. Okay, so this is a nice ergonomic handle. This is going to be what the assistant who is using this instrument is going to be grabbing onto to make all their different moves, to move the uterus up and down, side to side, so that we can see all the areas that we need to see during surgery. And so also that we can elevate the uterus and cervix away from the ureter, which is that tube that connects the kidney with the bladder. Okay, so I wanted to provide a brief tour of what a uterine manipulator looks like. So let me know what questions you have.